So today's reel is about cervical cerclage. Now this is a very important topic from your exam point of view. First, it's important to understand what are the indications for doing cervical cerclage. The indications are under three categories. The first is history indicated, the second is ultrasound indicated, and the third is examination or emergency cerclage. Now, history indicated is basically when the patient presents with a classical history, and to do a history indicated cerclage, the history should be 3 or more painless recurrent mid-trimester abortions. That is when you can do a cervical cerclage. The second indication is ultrasound indicated, when the woman has one or more history of a mid-trimester abortion or a preterm birth with an ultrasound finding saying the cervical length is less than 2.5 centimeter or there is funneling of the cervix. And the third indication is a rescue cerclage or an emergency cerclage or an examination indicated cerclage, where the patient comes in the mid-trimester with history of pelvic pressure or pain, and you examine her and you find the cervix is opening up or the cervix is short in length. You can do an emergency or a rescue cerclage. Now, when is a cerclage done? The common types of cerclages are done during pregnancy. Ideally around 14 weeks is the best time to do it, because by then you would have done an NT scan, looked for major anomalies, and that is the best time to do it at the beginning of the second trimester. You can do it till 28 weeks. Beyond 28 weeks, beyond the period of viability, we usually don't do a cerclage. Now, the most important thing is the types of cerclage. What are the different types? We have two main categories: transvaginal cerclages and transabdominal cerclages. So in transvaginal cerclages, we most commonly do a McDonald cerclage, which is basically a purse string suture around the cervix. But this is a little low down. So if a McDonald cerclage has failed, then we offer the woman a Shirodka cerclage, which is pushing the bladder up. We go as close to the internal os as possible, again through the vaginal route. There is another third procedure which is called the worms procedure, which is again a different type of suture placement, which you can see in the diagram. So we basically have three: McDonald's, Shirodkas and worms. There is a fourth procedure called the Lash and Lash procedure, but remember, the Lash and Lash procedure is basically done before she gets pregnant. So it is never ever done during pregnancy. What is done is it has been found that some cervixes have a abnormal area, and that area is excised and the cervix is sort of reconstructed, and this procedure is done before pregnancy. Remember this. If it is done, delivery is always by a cesarean section, and the sutures do not have to be removed, unlike McDonald's, Shirodkas and worms. The second type of cerclage is the abdominal cerclage. Now, abdominal cerclage could be laparoscopic or laparotomy. This is also called the Benson and Durfee procedure because it was introduced by them in the 1960s. That is the laparotomy, but now advancements have enabled us to do this by a laparoscopic approach also. This can be done before pregnancy. Preferably it is done before pregnancy, but it can also be done, and many times it is done during pregnancy also. So these are the two types of cerclage. Remember, if you're doing a transabdominal cerclage, then again delivery is always by a cesarean section, and the suture need not be removed. It is removed only after she has completed her family. So these are the types of cerclage procedures, and this is a very, very important topic which you all should know.